Greetings and welcome to Communication 202, a deeper understanding of GI illness through a patient-centered approach. Now, why am I calling it Communication 202? Well, as you know, we have been producing videos to teach communication skills that improve patient-provider relationship for many years. Most of them talk about the basics. How do you listen actively or use open-ended questions and so on. But this video will take you to a much deeper level. It will teach how to understand the meaning behind the illness and how to handle difficult communication issues that may come up. So what we've developed is a series of 6 clinical vignettes. Each one has several segments. First, there is an ineffective interview where things don't go very far and are associated with mutual dissatisfaction on the part of the patient and doctor. The second segment provides for a patient-centered, facilitative interview that discloses more meaningful information and leads to the discovery of important clinical information. All of this produces patient and doctor satisfaction. The third segment is an interview with the patient in character who discusses her perceptions of the 2 interviews, how it felt to experience the visit, and what she liked and didn't like about the experience. Finally, the fourth segment is a step-by-step analysis of the interview process, what worked and didn't work in engaging with the patient and establishing an effective patient-provider relationship, and why. We certainly hope that this program is enjoyable, informative, and most importantly, will help you in your clinical practice. This is case vignette number 1. It describes a 17-year-old adolescent currently attending an exclusive girls' school, and she is referred to see the gastroenterologist after an episode of hematemesis, which is bloody vomiting. She was diagnosed by endoscopy to have a Mallory-Weiss tear in the esophagus. She has a past history of heartburn, which has been treated with antacids. Hi,
Hi.
Megan.
Yeah.
Yeah, hi. How are you?
Good. How are you?
Nice to meet you. So, what brings you here?
Well, my mom made me an appointment with you because I had some bleeding in my esophagus. So.
Yeah, I saw the endoscopy note. I guess that's why you're here.
Yeah.
They found a Mallory-Weiss tear.
Yeah, I guess so. I don't know.
Yeah, I mean, that's bad. It means you had some pretty bad vomiting. Were you sick? Did you have a bad stomach virus or something?
No, I mean, yeah, I was vomiting, but I mean, whatever.
Okay. Well, I guess, have you had problems with heartburn or things like that?
No, not really.
Oh, no, it says here that you've had heartburn for a couple of years.
I mean, sometimes.
Do you
but
take antacids or anything like that?
If it's bad enough, maybe I'll just take some Tums or something. This doesn't really seem to be that big of a deal to me, though. I mean, I feel fine now. I don't feel like I'm not sick. So, my mom is the one that made me come see you.
Right. Well, I understand that. I mean, it sounds like you've had a lot of heartburn and you threw up blood at this point. So we have to try to.
Yeah, but it was not a ton of blood.
Okay. Well, how much do you understand what's going on here?
Like what?
Well, you're here because you have a medical problem that we're trying to treat.
Well,
and it sounds like it's not very important to you.
Well, it's important to me, but I don't understand what you're saying. You're saying all these doctor words, and I don't understand what you're talking about.
Okay, so what's been happening is it sounds like you've had what we call reflux. That means that acid comes up and it can irritate the esophagus. And then you had vomiting, and vomiting means that you are throwing up, and that can cause more injury to the esophagus. And at some point it got so bad that you caused it to tear. and bleed. Do you understand that part?
Yeah.
Okay. So how long have you ever thrown up blood before?
No, I mean sometimes, but not a lot. That's more recent. The blood thing is more recent.
Okay. Well, I mean, at your age, I mean, do you ever make yourself throw up?
No.
Okay. All right. Well, it's something that I need to ask because a lot of young
Whatever.
girls will throw up and have because they want to stay skinny. You know what I mean? I mean, you look pretty good to me right now.
I I don't know. Thanks, I guess.
Well, okay. So we got to get you on a proton pump inhibitor, which is something to block acid to treat this. And
Is that gonna hurt?
no, it just suppresses the acid.
Oh.
It just keeps you from having this heartburn. But as far as the vomiting, I mean, you've been worked up. We just have to kind of keep an eye on it and try to figure out why you're throwing up.
Is it gonna keep happening? Like, will the medicine fix it?
Well, the medicine will help the heartburn, but as far as the vomiting, maybe we need to understand more at some point about why this is happening. But
It just happens. I mean, like, it just happens.
well, we call that sometimes functional vomiting, and sometimes that happens with stress. If you're stressful, people throw up. Are you under any stress? You're in school now.
Yeah.
Grades doing okay?
Yeah. My grades are fine.
Okay. Things okay at home?
Yeah. I mean, I'm an only child. I don't have any problems really. I mean, I like to
Okay.
fight with my mom sometimes, but whatever.
Yeah, I mean, that happens. So really, it's just typical kind of teenage stuff going on right now.
Yeah, I mean,
Well,
I get good grades and I have friends and I have a boyfriend and, you know, I'm
Okay.
fine.
Well, why don't I just give you a prescription for the medication, and maybe you can, if you have more of the vomiting, why don't you come back and see me, and we can see if we need to do another endoscopy or see if something else is going on. I really don't think there's anything serious happening, but we'll just do that in case it gets worse.
So I have
Okay?
another one.
Well, no, I'm not saying we need to. I'm saying if it gets worse, if you throw up some more, we
Oh,
might want to have another look again. Okay?
all right.
All right. Well, all right. Take care.
All right, bye.
Bye. Hi, Megan. I'm
Hi.
Dr. Drossman. How are you?
Good, how are you?
Nice to meet you.
Thanks.
Well, I hear you were sent over here
Yeah.
because of some problems you've been having.
Yeah, my mom wanted me to come and see you. She's a little bit worried about me, I guess. Because I was in the hospital and she's just concerned just to make sure I'm okay, I guess.
Okay. What was the problem that got you into the hospital?
I had some bleeding, like in my esophagus, I guess. And
How did you know that? Did you throw up?
yeah, a couple of times.
Okay. And so you threw up and you had blood come up?
Yeah, yeah. Yeah, it was I don't know, it wasn't like a lot of blood, but it was enough, I guess. So,
But that's why you're here, because
Right.
they want us to find. I understand you did have an endoscopy from your records. You know
Yeah.
what that is,
yeah, they put that thing down your throat. Yeah.
and they found a tear, what's called a Mallory-Weiss tear. And
Yeah, that's what
bec-
my mom said.
And that's from if the vomiting is very violent, if it's very intense. Is that what you
Oh.
remember?
Yeah, I mean, I guess. I mean, vomiting, like, throwing up is always kind of hard to do. So.
Sure. Sure, I understand. I guess people do throw up, but the fact that you had bleeding come up meant it was
Yeah.
maybe pretty serious to some people. What do you think about that?
Well, I mean, I feel fine. So I don't think it's that big of a deal. My mom like making it a bigger deal than it is.
I see.
But I mean, at the same time, the doctor at the hospital kind of scared me a little bit. So I just wanted to make sure, like, that I'm not going to die or something. So, but my mom is really, really concerned. So I just want to also make her feel better.
Okay, I understand that. I also want to understand more about what this is like for you. That's important too, how you're feeling with this. And maybe you could tell me a little bit more about if you've had vomiting or symptoms like this before.
Yeah, I've had vomiting before, for, I don't know, like maybe a couple of years, I guess.
And does that vomiting occur when you're sick or nauseated?
Yeah, I guess, yeah, there could be any time. Like, I'll eat something, like I'll be really hungry and then I'll eat a lot and then I don't feel very well and so then I'll throw up.
I see. If you eat a lot of food.
Yeah.
And you're in school now, right?
Yeah. So I go to a private girls' school, and it's pretty challenging. So I have to work really hard to keep up my grades, and my parents are like, "You have to keep your grades. You have to go to college. You have to da da da." So whatever. Like I just.
What would you like to be eventually?
I don't know. Maybe I don't know. Maybe a lawyer. I like to argue a lot.
Okay. Well, so you've had this vomiting going on for quite a while.
Yeah.
For a couple of years.
Yeah.
And it sometimes happens around food. Is that right?
Yeah, because I don't know, like I'll just eat a bunch. You know, you'll like eat, it tastes so good, and then you'll just feel like sick, like
So-
really bloated.
Feel very sick after. So are there times where you kind of eat a large amount, kind of?
Yeah, like I'll eat a lot of food because it tastes really good, and I like to eat. But then I'll feel really just kind of gross, and just kind of have to.
Do you ever have to, with all those feelings, make yourself throw up in order to feel better?
Sometimes maybe. Because sometimes your stomach feels just gross and you just have to get it out.
I can understand that, yeah. So do you find that there are times where these vomiting episodes occur more often than other times in your life?
Well, sometimes. I mean, so like a couple of years ago, we were at this family reunion, and there was all this awesome food, and it was really, really good. And then, so I was like eating with my friends, and then somebody said something about like how much weight I'd put on or whatever. It was so rude, and I was just like kind of stuck in my head. So I like always think when I'm eating, like hear that voice, like, oh, look at her, she's so fat. Oh, her butt is so big. I don't know. It's like kind of makes me feel bad.
Sure.
Like I don't want to do it, but it's just kind of like, I don't know.
You know, Megan, it's not uncommon. That does happen to young girls sometimes when they feel concerned about their weight and all of that.
Really?
I also wonder if what is your school life like? How is you doing with that? Do you have any social activities? Tell me a little bit more about yourself.
Yeah, so I have a lot of friends, and sometimes they're mean though, you know, because I go to an all-girls school, and so girls are mean sometimes, and they'll say things about how another girl looks or what she's wearing or whatever, and so sometimes that's hard, you want to fit in, and so I don't know. I feel like there's a lot of pressure to like look a certain way and dress a certain way and be a certain way, and so yeah, I mean, there's that. And then so I have a boyfriend, and he plays football, and he goes to a different school, of course, but our schools like have stuff together all the time, so that's kind of nice. But we're gonna be graduating soon, and he's like, I've been dating him for a while, and he's a nice guy and everything, but I don't know. There's like a lot of, I don't know. Lately, he's been like really making me feel uncomfortable. And so,
Feel
well, I
uncomfortable?
like him a lot, but I don't know. Like he's like, oh, come on, Megan, we're gonna graduate soon. Don't you love me? I don't know. It's like really pushing me to sleep with him, and I'm just not ready. Just not ready for that. Like it makes me really anxious, and it makes my stomach hurt, and then I don't know, like when my stomach hurts, and then I start getting really fearful almost, and then sometimes I'll just be like, I gotta like throw up, I gotta eat, and I gotta throw up. It just makes me feel like I have some sort of control over something, because I don't know, it's like so many things are not, they're just up in the air in my life, and it's kind of hard. Like, what am I gonna do with my life, and where am I gonna go to school, and my family's pushing me to do things, and
Sounds like you're really feeling not in control of many things right now.
yeah.
Is there anyone you can talk to about this?
No, because if my mom knew, she'd freak out. And my friends are like, I don't know what the problem is. He's so hot. You should just sleep with him. They don't understand. They would just judge me if they knew like what I was doing.
So he's pressuring you to have sex, and you're not feeling you're ready for that.
I don't. I'll be ready when I'm ready. I don't.
Can you say more about that? Why that's so stressful for you right now?
I don't know. I mean, I just have a lot of anxiety when I think about that kind of stuff. And
Have you ever had sexual relations before?
no. Like, when I was little, this friend of my dad's, like, he did some bad things to me, and it just makes me, like, when I think about, like, sleeping with my boyfriend, it just brings back lots of bad memories. I don't know.
And you've not been able to share this with anyone?
No, because my parents would just think it was my fault. Because he was my dad's friend. Thank you. I don't know.
Well, Megan, we've talked about a lot of things now.
Yeah.
We've talked about things that are very personal to you and maybe affecting why you feel so trapped and so helpless and out of control. I'd like to work with you on this. We're certainly going to treat the symptoms you've had about the vomiting. We can look at medication, but I also think it might be good if we found a counselor who works with teenagers like yourself, who've experienced the same things. You're not alone with what you're going through. This is not uncommon, and I think that there's a path to get you moving forward and feeling more in control of things and better.
But you won't tell my mom, right?
Well, that'll be your decision with us when we go through this. I'm not going to volunteer that to her right now. I'm going to tell her that we're working on your symptoms and your problems, and then when you feel you can tell her, and I think there will be a time when you might be able to, then you can make that decision.
Okay.
All right?
Okay.
All right. Well, let's get started then.
Okay, thanks.
So Megan, tell me a little bit about the first interview. What was that like for you?
Well, it wasn't great, frankly. He was kind of a jerk, and he was mean to me, and then I don't know. I didn't like it.
What did he do that made you feel that way?
Well, so he basically, he just kept talking about how serious my problem was and using a lot of words that I didn't understand, and kind of scared me a little bit. And then was like, but I don't think it's anything serious, but do you understand how serious this is? It was confusing. And then he was like pressuring me to tell him more about why I was throwing up when he clearly didn't even care. I don't know. And then he said, like, well, some people throw up and some girls do that. But I wasn't going to tell him that I was one of those girls because I don't think he would even care. Like, I don't think he really cares to, like, help me solve this long term. And he was like, oh, come back and see me if you need to. And
What about the treatment plan? What was that like?
well, I didn't understand it. It kind of sounded like it was going to hurt. And then he was like, oh, no, it's just a medication. Bottom line is, I don't think that he really cares that much about his patients. He doesn't take time to explain things in a way that they can understand. I'm not a doctor. So I didn't feel very comfortable, and I don't want to tell him anything personal because I don't think he would even care.
But that changed in the second interview. What can you tell me about the
Yeah.
second interview? How was that different for you?
Well, I kind of felt like I was talking to like a friend, and I don't have a lot of people that I can talk to about the stuff that's going on in my life. So that was really nice. And he just was really kind, and he kept like saying that he understood and that I wasn't the only person that deals with this kind of stuff. And so that made me feel better because, I don't know, sometimes it can feel like you're the only one and you're kind of alone.
So as you look at the differences between the two, what allowed you to say more of a more personal nature?
Well, he wasn't judging me, and he seemed to show a lot of empathy for what I was saying. And the first guy I felt like was all judgmental. So that made a big difference.
Okay. Well, thank you.
Thanks.
Let's discuss the critique of case vignette number 1. For these interviews, the goal is to primarily demonstrate ways to establish with this adolescent a sense of trust that would enable her to disclose highly personal information. The first, or the ineffective, interview was not facilitative, as the doctor used close-ended and leading questions and made judgmental comments. There was a lack of engagement. The patient was dissatisfied and was unwilling to disclose personal information that would be relevant to the treatment. Let's look at some of the features of this interview. Note that the doctor used technical jargon that Megan didn't understand. They found a Mallory Weiss tear. So we got to get you on a proton pump inhibitor. Some statements were frightening. Yeah, that's bad. It means you had some pretty bad vomiting. The doctor was judgmental and talked down to her. How much do you understand what's going on here? It sounds like it's not very important to you. At one point, the doctor was insensitive and inappropriate when trying to address the possibility of an eating disorder. A lot of young girls will throw up and because they want to stay skinny. You know what I mean? You look pretty good to me right now. As noted in Megan's summary comments in segment 3, she notes the physician's behaviors made her feel pressured and judged by the doctor, who she perceived as uncaring, and she did not feel comfortable discussing personally meaningful and relevant information.
And then he was like pressuring me to tell him more about why I was throwing up when he clearly didn't even care.
Let's go on to the second interview. In general, the doctor used more open-ended questions and permitted greater periods of silence. He engaged the patient with good eye contact, a gentle tone of voice, and affirmative nods and gestures, which allowed Megan to feel trusting enough to go deeper into her life history. The doctor actively listened and was able to compose more relevant and focused questions that reflected on where she truly was. He could address her thoughts and emotions in relation to the history as it unfolded. Here is the segment leading to the diagnosis of bulimia. Well, so you've had this vomiting going on for quite a while,
Yeah.
for a couple of years,
Yeah.
and it sometimes happens around food. This was to learn about possible associations for the symptoms.
I'll just eat a bunch, you'll like eat, it tastes so good, and then you'll just feel like sick, really bloated.
This led the doctor to address the possibility of binge eating. Are there times where you kind of eat a large amount,
Yeah, like I'll eat a lot of food because it tastes really good, and I like to eat. But then I'll feel really just kind of gross.
Following up on this, the doctor gently asks, with all those feelings, make yourself throw up in order to feel better? She then is able to acknowledge the bulimic behavior but looks uncomfortable after disclosing. In response, the doctor is empathic and reassuring. I can understand that, yeah. Next, the doctor gently explores possible triggers for the bulimic behavior. Do you find that there are times where these vomiting episodes occur more often than other times in your life? Megan then discloses how she felt when someone said she was getting fat, which was the trigger for her bulimic behavior.
Like a couple of years ago, we were at this family reunion, and there was all this awesome food, and it was really, really good. And then, so I was like eating with my friends, and then somebody said something about like how much weight I'd put on or whatever. It was so rude, and it was just like kind of stuck in my head. So I like always think when I'm eating, like hear that voice, like, oh, look at her, she's so fat, oh, her butt is so big.
This made her feel bad and somewhat guilty. The doctor provided reassurance and validation. You know, Megan, it's not uncommon. That does happen to young girls sometimes when they feel concerned about their weight and all of that.
Really?
The doctor then showed interest in her life in general and was then able to gather more information about the circumstances for the bulimia. What is your school life like? How is you doing with that? Do you have any social activities? Tell me a little bit more about yourself. First, she discusses her life being at an all-girls school and her boyfriend. Then she mentions her boyfriend is pushing for her to have sex, but she is not feeling ready.
It's like really pushing me to sleep with them, and I'm just not ready. For that.
And she is also having other pressures from family and to look a certain way and make life decisions. She then is able to link her anxiety around these pressures to the bulimic behavior to decompress the feelings of distress.
Like it makes me really anxious, and it makes my stomach hurt, and then I start getting really fearful almost, and then sometimes I'll just be like, I gotta like throw up.
The doctor provides empathy and validation. Sounds like you're really feeling not in control of many things right now. The doctor tried to determine if there is any support for her. Is there anyone you can talk to about this?
If my mom knew, she'd freak out. And my friends are like, I don't know what the problem is. He's so hot. You should just sleep with him.
The deeper issue of early abuse was then disclosed because she is now more comfortable and supported by the doctor, and the line of discussion leads her to experience the feelings of anxiety, which reverberates to the earlier trauma. He's pressuring you to have sex, and you're not feeling you're ready for that. After indicating she's not ready for sex with a boyfriend, the doctor explores the possible reasons. Can you say more about that? Why that's so stressful for you right now? She then discloses sexual abuse in childhood and becomes tearful, connecting the anxiety of current pressure for sex with the past experience.
When I was little, this friend of my dad's, like,
He did some bad things to me.
The doctor notes to her that she can't share this with anyone, and she responds,
No, because my parents would just think it was my fault.
The doctor notes the tearfulness and offers a tissue. Being aware of her sense of isolation and inability to share her feelings, he offers to work with her. Well, Megan, we've talked about a lot of things now.
Yeah.
We've talked about things that are very personal to you and may be affecting why you feel so trapped and so helpless and out of control. I'd like to work with you on this. We're certainly going to treat the symptoms you've had about the vomiting. We can look at medication, but I also think it might be good if we found a counselor who works with teenagers. Then he further reassures her, you're not alone with what you're going through. This is not uncommon, and I think that there's a path to get you moving forward and feeling more in control of. When she asked the doctor not to tell her mother, he lets her stay in control by saying he won't tell the mother, and at some point, when Megan is ready, she can tell her herself.
But you won't tell my mom, right?
Well, that'll be your decision with us when we go through this. I'm not going to volunteer that to her right now. In her summary comments, Megan felt that she was talking to a friend who was not judgmental, and she was reassured that she wasn't alone with this.